I'm Sheena Larson, and this is my clinical mentor, Dr. Dickinson. He is just going to be monitoring me, doing some draping and patient prep. So this is my dog Kane. He's going to be getting a microchip right now. He's a little bit sedate right now because he's been pre-medded, but even though I know that he hasn't been microchipped, it's policy to always scan for a microchip before one is administered. So I have the microchip reader, and I'm just going to take this, and it says reading, and I'm going to scan back and forth in between the scapulae where the microchip is usually administered. It can migrate, so I'm just going to scan all of him. He's a big boy, so it says no transponder found, but I'm going to keep going. Down the legs. Oh, he's shedding like crazy. There we go. But no transponder found. So we are good to place the microchip in Kane. So now this is the microchip that I'm going to be placing into Kane. So I just want to scan it to make sure that the numbers match on the barcode, which they do. So I'm going to open this up here. We're going to be placing it in between his scapulae. He's just getting prepped, so find his shoulder blades, dose that with alcohol. So as you can see, it's a very large bore needle here, and I'm just going to create a skin tent where that is going to go. And making sure that the bevel is facing up, I'm just going to go in under the skin. There we go. That's through the skin. So now I just want to push the microchip all the way in, and I'm going to keep this depressed while I pull out. And now I want to scan to make sure that the microchip has been placed. Oop. There we go, reading. There we go. So as you can see there, the microchip did pick up, so it has been properly placed into Kane. So now we're just going to continue with our prep. I'm Sheena Larson, and today I'm going to be prepping Lacey for surgery. So she has been induced. Amy here is just getting her tattoo. This is at the point that we would microchip, but the owner declined a microchip. So I'm just going to express her bladder as per Dr. Dickinson. On the ultrasound, you can see the lump. So I'm just applying gentle pressure because it is very easy to traumatize the bladder if you press too hard.
Oh, well, maybe bigger than it was. I'll get you guys to TPR it too.
Okay.
Can you help with cork this and TPR it while you're at it?
Yeah. Extension on, so it's literally a matter of disconnecting it.
There we go. So it wasn't a very large bladder, but
coming back up in the morning, we're going to do a PCV and see if it's worse.
So I'm just going to rotate her onto her back.
She doesn't want surgery.
And for an ovariohysterectomy, we're going to be shaving 2 inches above the umbilicus and then 1 to 2 inches on either side of the nipples down to the pubis. So I have my clippers here. So I'm going to start off by locating the pubis or the umbilicus. Which is there, and I'm just using a modified pencil grip. And right now I'm going with the hair to debulk most of it. And as I go, I'm just going to be getting rid of the hair. The shave is the part that the owners see, so it's important to make it as symmetrical as possible. Cat hair is very fine, so sometimes the clippers don't really like the shave for it. And I'm being very careful to not give her any kind of razor burn or anything like that. Going against the hair, as you can see here, gets a much closer shave.
Does he look a little better than what he did? Maybe you get him to see, huh? You let him know he's out.
If she had longer fur, I might trim the edges like this, just so that none of the side hairs would fall to where the incision is going to be located, which is right about here. And I'm just going to make sure that that is shaved particularly close. There we go. And I'm going to shave for a Doppler. So now that I've gotten rid of most of the hair, I'm just going to get somebody to pass me the vacuum, because with my broken leg it's a little bit awkward to walk around to the other side of the table. Thank you. Oh. There we go. And I'm just being very careful not to traumatize any of the skin or anything. Lint rollers also work very well on the fine cat hair for getting up at any of the super fine hairs that the vacuum missed. And I'm going to be using chlorhexidine and 70% isopropyl alcohol. So to start off with, I'm going to do a general wash. So I'm just going to pour some of that on there. I have warm water. I'm just going to get some. And this one here, the technique doesn't matter. It's just getting the chlorhexidine onto the cat and getting rid of most of the dirt. So as you can see there, I'm getting some fine hairs and some dirt. So I'm just going to repeat that. And just a quick scrub. In this particular case, I'm not being particular so far as scrubbing technique. There we go. So now I'm going to take off my lab coat. And I'm going to wash my hands using the same scrub that we use on the cat. There we go, and then I'm just going to put on some clean exam gloves, which I have here. So now for the surgical scrub, we're going to be using clean to dirty technique. So I'm going to just pour the chlorhexidine scrub where the incision is going to be, because that's what I want clean. And I'm going to use small scrubbing movements, and I'm going to rotate around, focusing on keeping the clean side pointed towards the clean side and the dirty side pointed towards the dirty side. This is a process that I'm going to be repeating 3 different times, and in between I'm going to be doing a rinse with the warm water. So I'm going to take this one here. I'm not going to be doing any scrubbing, but I'm just going to wipe, keeping everything clean to dirty, and I'm going to just wet that hair down. So repeat. With this scrub here. This is the second scrub. This is the target technique, keeping everything pointed in towards the target.
He's in the back. If you think it needs bandage, I will pop back there. I don't know, I think it's like that.
With my warm water.
I haven't done shredding, so they might be in for
I
shredding.
hope so, but I lost it like a minute or 2 after I wrote the number on it. Astro.
There we go.
70 something.
Final rinse with the warm water.
Her name? Astro?
Astro the dog?
Yeah.
Neuter?
Yeah.
That's it.
There we go. So that was the final rinse. So now I'm going to be doing the final paint. So I'm going to take off my exam gloves. I'm going to put on my mask because we're going to be going into the OR.
Okay.
So applying my scrub cap. Making sure that all of my hair is tucked in. There we go. So I have my PPE for the OR, and I am going to be doing the final paint. So I have the isopropyl alcohol. I'm just going to be using the tissue forceps here. This gauze has been soaked in the isopropyl alcohol. So I'm just going to use the forceps to grab the corners of the gauze. There we go. And using the same target technique, I'm just going to be rotating here like this, being very careful to not get anything else. And then I'm going to do one more. I'm using alcohol because I use the chlorhexidine. So I'm just folding my pieces of gauze in. So that I have a nice grip. So this is the final paint out here. I am going to be repeating the final paint in surgery. There we are. And now I'm going to be applying the transfer drape. So I have that here. I autoclaved this. You can tell from the color change that it was autoclaved. And I'm going to be reaching into the inside here. So then, and pulling this up, because then this way it's going to cover that, and I'm just going to place it. This is the only towel that we had, so it's a little bit on the large side, but I'm working with what we got. So now I'm going to transfer her into the OR. So I'm going to turn off, disconnect, there, turn off. And I'm going to pick her up, and I'm going to be very careful that I don't shift the transfer drape from covering the incision while I go into the OR. So I'm just going to position her. And I'm going to tie her into place. I don't want to overextend her limbs. But I want to make sure that she's not going to be rotating during surgery. So we have her in dorsal recumbency for the ovariohysterectomy. So now I'm going to be removing the transfer drape. Since it's a little bit large, it had folded over the edge, but I'm just going to be reaching over, careful not to reach over top, and I'm just going to take it and I'm going to lift, not drag. I'm just going to lift and pull towards me and drop. So now I have the sterile tissue forceps and a sterile piece of gauze here. As you can see, it's been autoclaved. So I have that, and then I have a bowl of 70% isopropyl alcohol. There we go. So I'm just going to take the tissue forceps and I'm going to fold up the piece of gauze here. I'm being a little bit fumbly here, but I'm working my best not to get that onto a non-sterile surface. So that stayed on the sterile surface. So I'm just going to put it into my bowl of 70% isopropyl alcohol, and just where the incision is going to be, I'm going to go, and I'm just going to go rotate, keeping clean to clean and dirty to dirty. Just rotating that there. And there, that's the final prep. So now Lacey is ready for her ovariohysterectomy, and she's ready to be draped, and Dr. Dickinson will start the surgery. I'm just going to add on a small clip of me performing a patient prep on a different patient, because for my previous video I didn't add my cap and mask before starting the surgical scrub. So I'm just going to show a clip with a different patient where that's what I do. And because we're going to be transferring her into surgery, I'm going to be putting on my cap. And my mask. I'm already wearing my booties. And for the scrub, I'm going to be putting on some clean exam gloves. So now I'm just going to be starting off with the chlorhexidine scrub. I'm just going to pour some right where the incision is going to be. I'm also going to add some photos of what the incision should look like after it's been cleaned, because I realized that I lost the video of me cleaning up the patient post-op. And I'm also going to show a picture of me cleaning up the OR. I don't know where that video went, but we use hydrogen peroxide to clean around the incision. We're always very careful not to touch the incision, because hydrogen peroxide can negatively affect healing. And we otherwise rinse with warm water so that it's not staying on contact with the skin, and we towel dry them, and we make sure that they're warm, and we make sure that all sharps have been put into their designated sharps container, and the biologics have been put into the freezer for incineration. So there's definitely stuff that happens post-op.